What's up everyone? In today's video, I'll be talking about fibroids. Can you get pregnant with fibroids? How can you get pregnant with fibroids? And there's this new trend about melting fibroids. Does this even work? How does this work? I'm going to talk about all of these in today's video. If you're new to this channel and you want to learn things about infertility and their solutions, please subscribe to this channel, turn on the notification bell below and like this video. I am Dr. Amarachi Ijeoma, a fertility doctor. Fibroids, they are growths on the womb that are benign. That is, they are not cancerous. They are rarely ever cancerous. And it's actually common in women of childbearing age. And it occurs in all races, but it's more common in black women. About 20 to 80% of women will develop fibroid before the age of 50. This means that out of every 10 women, about 2 to 8 women will have fibroids. But fibroid is not a death sentence because out of these 8 women with fibroid, about 4 of them will be living a normal life. This means that some women that have fibroids will not even need treatment at the end of the day. So you ask, can you get pregnant with fibroids? With a diagram, I'm going to be showing you how. So guys, this is probably going to be the worst drawing you've seen this week or ever, but I promise it will make it easier for you guys to understand. This right here is the womb, also called the uterus. This is the muscular part of the womb. This is the endometrium. I call it the baby bed. This is the neck of the womb, which is the cervix. This is where the baby comes out from. This is also where period blood comes out from, because period is the shedding of your endometrium. These are the ovaries and of course the fallopian tubes. Fibroids can be located inside the womb and it is called submucous fibroid. It can be located within the muscle of the womb called intramural fibroid. It can be located on the outer body of the womb called subserosal fibroid. It can also be pedunculated. Now, these three, the intramural, the subserosal, and the pedunculated, will not prevent you from getting pregnant. However, the submucosal can. But this is still not concluded. This is because some studies have said that if the baby is supposed to be implanted on a particular part of the endometrium and there's a submucous fibroid there, it can prevent the embryo from actually getting implanted. So this will now prevent pregnancy. Some studies also said that if you get pregnant with a submucosal fibroid in there, as the pregnancy is growing, sometimes the fibroid can be growing and it will be competing for space with the baby, with the fetus, and this can cause the fetus to die inside the womb. So these are the various ways that fibroid may actually cause infertility. So find out if your fibroid is intramural, if it's subserosal, or if it's pedunculated. If it is any of these three, then it will not stop you from getting pregnant. If it is submucous fibroid, that is, if it is submucosal, then it might prevent you from getting pregnant. Like I said, it does not mean that everybody with a submucous fibroid will not get pregnant. No, that is not the meaning. Some can actually get pregnant and even deliver the baby. However, when you get pregnant with a submucous fibroid, your healthcare provider wants to monitor you very closely, because as your pregnancy is growing, as the baby is growing, this submucous fibroid can also be growing. So we don't want that. We are going to monitor you very closely till delivery. So this is just the link between fibroid and infertility. Just like many gynecological disorders, we don't know the cause of fibroids. There are some factors implicated in fibroids. 1, genetics. Some women are just genetically predisposed to fibroids. Some studies have also shown that prolonged exposure of the womb to estrogen can cause fibroids. So they say when you see your menstruation early, like too early in life, your first menstruation, or it takes you a long time before you get pregnant, your first pregnancy, then it's one of the causes of fibroid, because then your womb would have been exposed to estrogen for a long time. Estrogen is a female hormone. Then other studies have shown that vitamin D deficiency, and lack of exercise also are implicated in fibroids. But none of these studies are conclusive. When you have fibroids, there are some symptoms that you're going to complain about. 1, no symptom at all. 2, painful menstruation. Heavy bleeding, the type where you're using several pads in a day and then you're complaining that you're seeing heavy clots. 3, or rather 4, you're complaining that you're having constipation, because sometimes the fibroid can be large, too large, that it is now pressing on the rectum. You can also complain of difficulty in urinating or frequent urination, and this will happen when the fibroid is pressing on the bladder. Also, if the fibroid is too large, you're going to complain of feeling pressure in your pelvis. So these are some of the symptoms you can actually feel when you have fibroids. Some of the treatments of fibroids include medical treatments. For example, birth control pills, intrauterine device, but I'm going to focus on gonadotropins. What we doctors do is, sometimes when the fibroid is too large and we want to do surgery to take it out, we give gonadotropins to shrink the fibroid so that by the time we are taking it out, there will be reduced blood loss during surgery, and so that it can give us a better surgical outcome. Now, what these gonadotropins do is, it shrinks the fibroid for a period of 3 to 6 months. And after this period, the fibroid might actually grow back again. Why I'm talking about this is because I've heard a lot of women, it's like a trending thing for people to say, person no dey do surgery for fibroid again, and all I have to do is take herbal concoction or take supplements or take tea and it will melt the fibroid. What exactly is melting fibroid? Because what I'm thinking is, this does not work. Some people will tell me that, so why is it that after they've taken these concussions, after they've taken these supplements, when they go back to do ultrasound scan, it doesn't show the fibroid anymore? Man, I can't explain this, but I can try to explain it. So this can be because maybe some of these herbal medications, some of these supplements contain gonadotropins that will now shrink the fibroid. So by the time you go back to do your ultrasound scan, it's no longer there. Emphasis on the word shrink, not melt. However, if you check in subsequent months, or if you check in a year after, you probably see the fibroid there again. But I will not advise anybody to take these herbal concoctions or these supplements for shrinking your fibroid, because these herbal medications, even if they contain gonadotropins, like small quantities of gonadotropins in them, how about the other contents of this concussion that can be detrimental to your health, that can affect your kidney, that can do more harm than good? I understand that it is cheaper, but think about your health in the long run. So my take on this is, it's better to be safe than sorry. So it's better to just see your healthcare provider when you have fibroid, because in the end, this fibroid that you're going to treat, you might not even need to treat them. It might not be causing any harm to you. It might not be affecting your fertility. So guys, if you've enjoyed this video, please subscribe to my channel, turn on the notification bell below, and like this video.